Perfect.
So that way I can
Perfect.
see them if I need.
I figured just in case you needed something
Yes, I
else.
appreciate it.
And look at us. And wow, somehow I got bald. It's just the strangest thing. I don't know how that happened.
Did that just happen?
You know, it must have been the equipment. It just, you know, this morning I had a full height of pompadour. And all of a sudden, you know, what are you going to do? Let me go ahead and shut this. The same code. Others coming in. Programming. And I get to be gatekeeper, so I get to see who's getting ready. We got 7 in the waiting room right now.
Hey.
And I'm going to take a couple of minutes to go ahead and to introduce us, introduce you. And so after that, the show is yours. And I'm going to just go ahead and test our system one more time. 1, 2, 3, 4, 5. Everyone say hello. Hello. Close enough, because the microphone is closest to you. And so that's what we want for our recording. Great. Let me go ahead and let's admit everybody. And I saw, and I'm assuming that
We got some fans here.
I was going to say, it looks like you're related to one of them.
Exactly. Sergeant Assiff is
Everything worked out okay. Had a couple things that a couple people asked this morning about links, and I was just like, it's coming, and that is good. When we sign up through, when we have people sign up through Eventbrite, it has a system where 2 days, 2 hours, and 20 minutes before a program begins, it'll go ahead and it will send you the sign-up information for the Zoom. And if it's an online only, you get it as soon as you register. But
right.
Because they're hybrid, it just takes on a life of its own. And if you've registered between one of those windows, of course, it's a very legitimate question.
Move this, I think, too.
I don't want to go ahead and pull that too hard because that's our camera.
Just roll this under.
Absolutely.
There we go.
Oh, I see what you're doing.
Just so I don't.
No. We don't want you tripping over furniture or anything like that.
That would not be good.
It would be memorable, and
yes,
I would delete the recording. So no worries about that. And we've got more people coming on in. For those of you who are just joining us, or for those of you who have been listening to us go ahead and ramble a little bit, hello, good afternoon to each of you. And I'm going to wave. I'm the fellow who just discovered that he's bald in the corner here. And my name is Seth Stander. I'm the community aging specialist for what is known here as HHCI Cares. The Hope and Healing Center and Institute has a special division for caregiving, aging, resilience, ethics, and spirituality, hence the acronym CARES. And our director, Dr. Peggy Dedemeyer, is actually out in the field today for a project. So it's my pleasure to go ahead and to welcome each of you. We have a few people here in person. We have more folks online, and I'll keep an eye on letting more participants in. And for those of you who are listening to this after the fact, we're glad that you registered and are looking forward to hearing back from you, along with anyone who is watching live in person or remotely about today's presentation, the title of which is How Precinct 2 Assists and Enriches the Lives of Seniors and Those Who Care. And we have the pleasure of hosting Connie Assiff, the manager of health services for Harris County Commissioner Adrian Garcia, Precinct 2's County Commissioner. A little bit about Connie before she goes ahead and starts, and I get our slides up for sharing. As I mentioned, Connie is the manager of health services for Adrian Garcia's Precinct 2 Commissioner's Office. She's a health educator and a connector of resources, empowering all populations to be resilient, active, and engaged in their communities. She has been featured on radio and television programs and has joined numerous health-related discussion panels. She also serves as co-chair for the Area Planning Advisory Council for the Area Agency on Aging. The acronyms for those are APAC and AAA, the other AAA, for those of you who may not be aware that we have every county and territory in the United States, as a matter of fact, has an area agency on aging, along with an aging and disability resource center, a long-term care ombudsman program, and all these other wonderful community services that your tax dollars help those who are marginalized receive service from. Connie has an MBA. She works as a community health worker instructor and uses her decades of public service and caregiver experience to build partnerships, establish trust, and reduce health disparities in vulnerable populations. We are very excited and honored to have you here, and I am going to go ahead and hand over the floor to you, even as I go ahead and hopefully successfully share the screen. And I believe I have done it. So, Connie, the floor is yours. We are so glad you're here.
Well, good afternoon, everyone. Thank you for those that are here in person. I really appreciate being invited here today. What is not on all of that he read so eloquently is that I have been in county government for 27 years. So this is my 27th year. And I came to the county government really as a steady job, which I really appreciated. They've been good to me. But I was more importantly, I was a granddaughter and a mother, a granddaughter, a wife, and I had to take care of my family. And I didn't realize myself how much I didn't know about resources that were available in our community. So that's basically what I want to speak about today. Precinct 2, we do assist a lot of families, not only older adults, but we say caregivers, which means sons, daughters, spouses, wife, husband, just the whole family. So we can go to the next slide. So I like to start out the presentation saying what Harris County is. Many people are confused, and I definitely get it. So I like to explain it in terms we can understand. If you look on there's purple, green, a pink reddish color, and blue. Those are the 4 precincts in Harris County. So Harris County is the 3rd largest county in the United States. I always forget the square miles, so I'm going to look at my notes. It's 1,778 square miles. So to give perspective, because I'm not good with numbers like that, it's bigger than the state of Rhode Island. So that's pretty good. Thinking about it in your mind. So let's go to the next slide so we can see the specific precinct 2. So even though inside Harris County is the city of Houston, which is the 4th largest in the United States, but remember the county is the 3rd largest county. Of course, I didn't mention who were the first. Any guesses? I think you know who beats Texas, even though we do things bigger in Texas. It's California. So they have the 2 most populous counties. Here on this graph, you could see the blue area is precinct 2. And that's the biggest question that I get a lot. They said, well, what is your jurisdiction? Where do you cover? Do I live? And I'm going to have a bonus slide at the very end so you'll know what precinct you live in and where to find it. But basically, that blue area, precinct 2, it goes all the way. We're on the east side. So East Aldine, Channelview, Deer Park, Pasadena, South Houston, LaPorte, Baytown, all the way to Webster. But specific and what is exciting, I think, in many ways about being in precinct 2 is we're very diverse. And it's very unique because we're very close. If you notice how the other precincts would be all around, we've got a waterway entry points in our precinct. So unique to us that we are open to water. We have the only free beach. I love to tell people that, and that's in LaPorte, Sylvan Beach. If you didn't know, it is there. And Precinct 2 is home to NASA, the Chip Channel, San Jacinto Battleground, Washburn Tunnel, and the Lynchburg Ferry. So I think that's very interesting about our precinct. So let's go to the next slide to see who we are helping. The population that we serve, it's very interesting to me that it's 70% minority. Thinking about where Precinct 2 is, we live close to, along that east side is the refineries. You think about Pasadena, 60.4% are Hispanic, 11.8% African-American, and 4% Asian. Now, this is probably, we don't do the stats so regularly, but this might be, a few years old, but it's still, it's pretty close. Some of the vulnerability barriers are the lack of transportation. We have the lowest median income, the lowest education attainment, highest dropout rate, and the lowest homeownership rate. So we do have a lot of mobile homes, and we do have a lot of different types of structures in Precinct 2 that people are living in. And we do have Harris County Transit, so we don't have the metro system, but still there's a lot of barriers to getting any kind of services, and that's for everyone. That's not just for older adults. So let's talk about some of the outcomes or what we're dealing with, what we would say in Precinct 2. We have higher rates of chronic disease. Chronic disease is something that is ongoing. That could be managing diabetes or high blood pressure. Alzheimer's is a chronic disease. We know that minorities have more of chronic diseases. We have the highest rates of uninsured, the lowest life expectancy rate. So there's something interesting about Harris County. If you wanted to know what is a good age, or what is the median age that people live in my zip code, you could actually find that out. So in Precinct 2, it's 76.9 years. We have the second highest hospital visits due to obesity, the second highest hospital visits associated with sexually transmitted diseases. And 12.3% of our car crashes are due to alcohol or drugs. So we have some quite interesting challenges. When Commissioner came to office in 2019, he did a health assessment. And so a lot of these outcomes have come as a result of a CARES report that was completed for the whole county. And that was in 2020. And that was by the health department, Harris County Public Health. And so that's where we found this is like a snapshot of some of the just issues or challenges that we have overall. So let's drill down a little to chronic diseases in older adults, because that's what we're talking about today. So the 10 most common chronic diseases, I love this graphic. It's from the National Council on Aging, and it is from 2021. And so I love it because it's just, you could just look at it. You could see men, women, 80% of adults 65 and older in our country at least have one chronic condition. That could be high blood pressure, high cholesterol. It could arthritis, diabetes. Diabetes oftentimes leads to a chronic disease, kidney disease, Alzheimer's. When you think about, I think about the pulmonary, when you think about your lungs, I think about asthma that we have in people that are living close to those refineries and things like that. I think about the air. So we know that at least 68% of adults 65 and older have at least two or more of those chronic conditions. So that means that our work in Precinct 2, because we have more minority communities, it is going to be challenging. We need to address the mental, physical, and the emotional well-being. So let's go to the next slide and see some of the challenges for older adults, and not only in our precinct, but that we focus on in our precinct is physical aging. And that could be maybe people are homebound. Maybe they can't get out due to different chronic diseases that they are dealing with. They're less ambulatory, hard of seeing, maybe hard of hearing, and they can't, get out to, socially engage. Healthcare costs is one thing that we all deal with, but particularly in Precinct 2, if they don't have access to get to a clinic or to get care of some kind, loneliness, because it's rural areas where we are. And I mentioned we don't have metro or some type of transit system, but even so, there could be all other challenges where people can't get out, the transportation. And I love this word, social climate. People look and say, what is that? Well, it's basically technology. The way that young people socially engage might look a little different than the way that older adults do that. And when I say older adults, I use that term very loosely, because people that are 50 years old, or it's all relative. I like to read my newspaper with the, I'm old school that way. It's hard for me to get out the device and look at it. So these are all of these factors. We're going to drill down and say how we are dealing with this in our precinct. So we can go to the next slide. So some of the things that we do is possible solutions, I call them, is preventative health actions. So we all know that a lot of the work, your health is not just you go to the doctor, and that's not even a good percentage. Most of the pie of the percentage of how we are healthy is outside that doctor's office. So that means preventative health actions, that could be some screenings. So we try to provide that. And I'm going to drill down on each of this, but this is an overview. Staying physically active and engaged. That's another thing that we do a lot in our community centers and throughout. Getting connected and attending community events. We have, at any given time of the year, no matter whatever it is, we're trying to do it. And like I said, we'll speak in more specifics as we go. Be active in a faith-based organization. So there is an aspect, and it's been, statistically proven that if we have some type of spirituality, it does go with our health. When people say a prayer for me, or people know that someone is praying for you, thinking about you, and you realize that your home, it lifts your spirit. So there is something to that. And then, of course, know where to find the resources for managing chronic conditions. So I just want to point out this picture right here. I picked it specifically because if you didn't know, the number one thing you could do for your body, and this engages all of your senses, is dancing. It lowers your risk for a lot of chronic diseases. If you got your coordination, you have your posture, everything. And if you really like who you're dancing with, and then your social is met too. But if you don't, you can always change partners, right? So I really like that. And of course, we're very diverse. So even though we have predominantly Hispanic, and I can attest to that, I'm out in the community a lot. And I think I would say 85%, at least who I speak to, are Spanish speakers. And I always encourage people. And I ask them, I said, do you speak English at all? And they'll say, no, I don't. And I am still surprised by that at times. And so that's another thing that we address. We have English as a second language, because so many of those people really do want to speak English, and they just don't have the opportunity, don't have the money to do so. So let's go to the next slide. So one of the great solutions that I really love that we do is our community centers. So our community centers, you can learn new skills. On any given day at one of the community centers, you can do wreath making, you can do chair yoga, you can do Tai Chi, you can all kinds of crafts and things that they can even learn new skills of a magnitude of just events. It's like a hub. It's like the hub of the neighborhood, which I really like. And it's not only in the day. We have evening classes. We have Zumba Amigas. We have for different groups. They have, of course, games, bingo, and staying connected. I think you can find on our website, you will see a multitude. It's a Valentine's Day social and all types of things. And a lot of these activities that we do are driven by the neighborhood. So each community center is not the same. It's a personality all of its own, which is so wonderful, because when you go there, then you know that it's the people that are driving these programs specific to their needs. And we're always improving that and listening to them and finding resources. We have a lot of people that come to the community centers they can't pay a light bill, or they don't know where to find the resource. And we are the connection for them. And I know a lot of us, I mean, even my own family, we might be proud sometimes and not ask for assistance. When you build that relationship with people, then they're more likely to say, they really do care. And I really don't want to ask, but, I'm asking for a friend. Do you know where I could find? And I always tell people when we give information, even if it's not for you, we all know somebody that can use different types of assistance. Obviously, exercising. I put these. We have a lot of these different exercise equipments in our community centers, and me as well. I don't like exercising by myself. If I'm with other people and I'm exercising, it goes a lot better. I feel a lot better, and I meet that social that I'm missing myself. Staying connected to your community, that's another thing we were just speaking about with the community centers. But this picture at the bottom is a picture of a nutritional class. And so we have specific classes to age groups. And this was a nutrition class. And this is another thing. No one wants to eat something that tastes like cardboard or it's bland. So they try to, we have nutritionists there. We partner with a multitude of agencies. And I think that's what it's really all about. Who you partner with, make it interesting, make it fun. And it's very strange. A lot of people will say, well, I can't understand how we're not so in tuned to this certain group. And I said, well, there's no difference between a person that's a younger person, a child, or an adult. Really, we're all human beings. So that means a younger adult would want to eat this. So an older adult's not going to want to eat that. So it's really across the board. Our needs are, we still remain people regardless of our age. So that's why we want to keep these connections. Next slide. So going to nutrition. So we do have a food program in Precinct 2. We can serve seniors 60 and above. And what I didn't mention in all of this is all of these programs that I'm referring to are free. They're at no cost to the community. So when people come out and take classes, if people come out 60 years old and they get together and socialize in our community centers, we do have what we say congregate meal sites. In a lot of our community centers, you do have to register. There is a process, but it's not very complicated. And we're going to share some more information at the very end on how people can do that. We do serve hundreds. It may even be thousands. I don't have exact numbers, but we do serve a lot of seniors' needs. And we also, this is a hot meal that we do in our community centers if the seniors can get to the center. And we also have homebound meals. Now, many people will say, oh, that's Meals on Wheels. And we say, well, it is like Meals on Wheels, but Precinct 2 has their own. We're not getting that. This program isn't coming from Meals on Wheels because, as you know, a lot of the agencies, they have waiting lists. So then we want to be sure that we're meeting the needs, nutritional needs, and getting a hot meal Monday through Friday to those seniors that may be homebound and they can't get out. And so then there's another aspect to this. We try to have the same driver at the same location, the same route. So that way we know that if Mrs. Jones or Mr. Garcia isn't coming out of the house like he normally comes out, or he's limping, or something's wrong, or she has a black eye, or then we know something is going on. And it's all about building relationships. It's not just about providing the service. It's about building a relationship with that person where they trust that Connie always delivers my meal. She's always smiling. She has a joke for me. And I fell, but I didn't want to tell anybody but I'll tell her. So then we can address that and take away that fear that they may have that, oh, we're going to turn their name in and they're going to be shipped off to a senior living facility. We try everyone. And that's the whole goal of all of these programs is aging in place, aging with dignity. I think that's the number one thing that we all want. So congregate meal sites. And we also have the senior box lunch program. And that all these are collaborations like through the Houston Food Bank. So many of these programs are probably not new because you could see a lot of these programs in other precincts throughout Harris County. What's unique about Precinct 2 is that we do have a nonprofit 501c3 precinct together. And we'll discuss that as we go further along. But that's how we're able to provide these additional services that, that the taxpayer, what we get is not, doesn't stretch to that. So we're very, pleased. I'm very pleased to be there to see all these wonderful programs. Next slide, please. So we also have Take a Bus Trip. So it's 40 years and going strong. So Thursdays, 55 and older at any given, they go to, at any given week, they can go to see the Houston Astros. They can go to different events, museums. And basically what it is our Harris County Administration Building is on 1001 Preston. So they can go 150 miles anywhere from that radius. And so that's for the seniors that come to our community centers. But the bonus is any senior group, and we do serve hundreds of senior groups, they can take advantage of a free bus, a free driver. They just have to have a coordinator to coordinate all that. It is on a first come, first serve basis. So we say to people, call us, and I'll share the number at the end of the presentation. But basically, it is meeting that aspect of staying connected, going where they want to go. All of this is really about listening. It's just like if we were, I always say I'm selling health because I'm in health services, but we listen to the consumer, we listen to the constituent and say, where is it that you'd like to go? And they give us these ideas. So I really like that we are able to provide not only trips for the seniors. I don't think there's many seniors that get on the bus that are just, they're just all down. You see in the pictures, they're all happy and they're, because it really, does something to be connected, going somewhere. And we do have, I do know personally some people that the spouse does have Alzheimer's, or they're, someone in their family. Very unique to our buses is we have, you can, your pastor can go for free with you. If your spouse is younger than 55, because you have a younger spouse under 55, then they can go. They don't have to be fit. And if you are taking care of a special needs, a child, like an adult, they go also on these trips. So we don't, and we also have lifts and wheelchair capability on some of the buses. We can go to the next slide. So the majority of the seniors that we serve, we do have a veteran services division, so department is specific to them. And the majority of these veterans that we're serving in Precinct 2, they are older adults. We help them apply for their benefits. And then we also have resources, and that could be a short-term utility assistance or other resources. And then, of course, we connect them to other community partners and case manage them if that is needed. What we always are looking for is we're always looking for volunteers. So if there's veterans that can come, our veterans office is in Channelview, Texas, and they're always looking for veterans to come and greet veterans that come to the office, remind them of their appointments, make phone calls. So I think that is something that is very unique, in my opinion, to Precinct 2. Not everyone has the veteran services, which I'm glad that we're able to do so many programs for them. I have a lot of family of mine that was in the military, and it's always great to honor them. Next slide. So these are some of our empowerment programs. Some of our empowerment programs include a transportation voucher program. And what that is that provides a voucher for transportation, not only to doctor's appointments, but maybe to get your hair done, or maybe to go to church or run some errands. So we do have on a lot of these programs that are free, of course, there might be a waiting list. It just depends on the need at the time. And then we also have done in our precinct minor home repair. So the minor home repair, and I have a note here so I don't forget, we've provided plumbing, electrical, flooring, and we've been able to do besides ramps and things like that. Now you might think, well, the Area Agency on Aging does provide that, and that is true. But we all have to work together. We all can't do it alone. So the more agencies that are doing these type of services, and again, we do this through our 501c3, then we're able to meet the needs of more seniors and keep them aging in place, keep them independent. But the thing about this is some programs, you must live in a home. And so remember, some of our precinct too, they don't live in a home. They might live in a mobile home. And so they will, fall through because other agencies require that you live in a home. And so we are able to, pick up those individuals that otherwise would not get services. And so that is amazing that we're able to do that. Adopt a Resident program. We have that every Christmas. Activity directors from the nursing homes, they go and see the residents in their nursing homes and see they don't have visitors. This is their favorite color. They like crosswords. They like this. And local churches call us and say, give me the list. And they go out, they purchase these gifts specific to the people, and just, not just random, but specific, and brighten every year those nursing homes residents. So there's blessings on both sides. The churches are blessed. They're doing something that they really want to do. And the residents in the nursing home then know that someone really cares about them, especially if they're not getting visitors. And then we have an annual holiday party for seniors. We had it at the Pasadena Convention Center. That's usually where we have it. We had it in 2022. I think we had 1,400 seniors. We provided them with food. There was a lot of entertainment, dancing. We even had health screenings. I even got asked to dance a few times, and I was like, okay, sure. I think I hadn't danced in years, so I had a lot of fun. The Grinch was there, Santa Claus, and they were all on the dance floor dancing. So I thought that was a lot of fun. You can see, and it was a pajama party, so everybody was dressed in pajamas. And with our buses, we were able to bus all the seniors from different community centers to the Pasadena Convention Center. And then the last program that I'll talk about is Beat the Heat. So Beat the Heat, because we live in Texas, and we definitely have to beat the heat here. But we provide portable air conditioning units for those seniors that might be in need. And we even provide the installation, if they really need it. So this is just a snapshot. We have others. Let me see what else we have on the next slide. So now we're going to talk about where I am, even though I've talked about some exciting programs, health services. So health services was brand new to the precinct. Commissioner Adrian Garcia created that because he saw the need from the Harris County Public Health 2020 CARES report. So in a nutshell, what we're trying to do is we're trying to cross collaborate with different partners and say, how can we meet the needs? How can we do this? I'm not going to read all the main thing is that we want to improve health outcomes and encourage people to do this. Decrease the health disparities, no matter what zip code they live in, where they're at, they don't have access. Let's do something to meet those needs. So let's go to the next slide. So this is what we're going to talk about, which are health related specific in my mind and in my area where I am. We're going to talk about smart pods, the mental health pod, health kiosks, telehealth program, which is it's not quite there, but we're almost there. And the Health and Human Services Community Partner Program, Harris Health Financial Assistance, and of course, pneumonia flu shot clinics that we have. So we can go to the next slide. So this is probably one of the most exciting things that I saw when I came to the precinct. And even when I talk about it, I still have to look at my notes, but it is amazing. So we have 2 health pods. We partner with Baylor College of Medicine. They basically partnered with us to create this. This was a huge investment because we were talking about access to health. The seniors cannot get to the clinic, or they cannot get, if they had, scraped on a rusty nail, they can't get the tetanus shot. They're uninsured, or transportation, a lot of things. So the health pods are the first in the United States. We have 2 of them in our precinct, one in the Aldine area and one in Pasadena off of Spencer Highway. So the one in the Aldine area is at our Northeast Community Center off of Bentley. And so what they provide is clinical services for anyone. They don't have to be an older adult at no cost. And some vaccinations that they have. They're also able to write prescriptions and help people manage their diabetes or chronic disease. So the smart pods, they were designed in the wake of a 2014 Ebola outbreak. It's a deployable field clinic with all the advantages of a modern clinic. So Harris County did purchase these 2 health pods, and they were the first in the U.S. They serve medically underserved areas, and they do expand to 400 feet. The thing that's so special about this is they have a 0 negative pressure room. So inside the mobile clinic, there is a room where you can slide the door. And especially we know during COVID time, we were able to isolate, the air and air so that it doesn't spread to the other. And so that's, very ideal, especially with what we had gone through. These health pods, we can go to the next screen. These health pods have been in place for a little bit, but at the height of COVID, they transitioned to a COVID vaccine and to a COVID testing site, drive-through. And so even today, they're still functioning as that, because there is and still is a high need, but very soon we'll be transitioning back to the clinics that are in the neighborhoods, so that people that live in these neighborhoods, they can just walk up, just like they walk up to the community centers. So it's like a mini clinic right in their neighborhood. And these are the high area of needs. So this is just a snapshot of statistics from July 2021 to March 31st. This was in 2021. There were 16,872 visits. And we had that statistic. So I wanted to bring one statistic so you could see, but we know that there is a high need. Let's go to the next slide. So this is another most exciting program that we were able to roll out. And this was in November of 2022. The commissioner was able to open the first mental health pod, because mental health is such a need, not only in our precinct, but in all of Harris County. Some of the programs that I'm talking about today are specific to Precinct 2, but people ask me, can I go to the mental health or can I go to the health pod? I don't live in Precinct 2. Yes, you can. If you live in Harris County, you can go. There's no cost. Now, logistically, it may be not that close to you, but if you could get there and you're able to get there, then we definitely would not turn anyone away. Of course, we want to keep it to Harris County. Usually if people come from Fort Bend or other counties, we'd have to, look at that. But mainly it's for Harris County. So there, the free services that we'll provide in the mental health pod, we partner with Catholic Charities to do mental health therapy for children, and the mental health the Harris Center for Mental Health and Intellectual and Developmental Disabilities does the mental health therapy for adults. And of course, that's at no charge. So they've already begun seeing adults there, and soon they will be starting to see children at that mental health pod. So that's pretty exciting. So another thing on the next slide is our access to health kiosks. And so these are health kiosks that are located in different community centers, as well as Harris County annex buildings. So some of these annex buildings are where people would go and transfer their title on a car, or they're registering their business, LLC. So there's a lot of traffic in these areas. These are free as well. They are digital touchscreen in English or Spanish. And you could check your blood pressure. And again, all of these are through partnerships with the AmeriGroup, with Aetna, with different partners and community, even for-profit companies, even because of our uniqueness of the 501c3 in our precinct. But basically, you can track all of this, even your weight, body mass index over time. And that would give you an indication that, you know what, it's a screening. Maybe I need to go to the doctor. Or what's my normal blood pressure? And I come in here every day and I see Seth and my blood pressure goes, okay, well, no.
Hopefully it goes down.
Hopefully it goes down. Well, it's okay. But you never know, like what is your trigger? Did you eat something? You came to the center, you ate something, and there you're taking. So it is a good measure of trying to see. One of the center managers told me yesterday, she said, somebody came in the center and they had their notebook out and they were looking. And I said, well, it tracks it. And she said, oh yeah, but she was there looking at it and testing it. And we also have an oximeter. So to check the oxygen, that's one thing I didn't mention, which is very good, also, even during COVID time and even not. It's just good information, but this is for all ages, obviously, but it's good, what we say, access to health, where normally you would have to go to Walgreens or normally you would, but if you're already at the community center and it's there, why not use it? Then maybe it's a good indicator of, am I feeling okay? Something going on? Am I taking new medication? I think that's the number one thing for older adults is they take a multitude of medications and maybe there's a side effect to something. And so that might be a way to do this, to find out, is something going on? This is coming. This is exciting. This is like what we call the telehealth booth. So you won't go in there and change into Superman or Superwoman, although it's of course, that's back in the day when we had telephone booths. Well, not everybody would recognize that, but the telehealth booth, they are soundproof. And we tried the best to do that because what it is it is a booth where people can go in, older adults that may not have access to the internet or they may not know how to use certain technology, can go in the telebooth and they can virtually visit their provider through telehealth. They're already at the community center, but they don't have all this technology or know-how. And so this is able to help them. We soon will have digital literacy classes to help with that. This is going to be a new initiative. It's not officially open yet, so I'm giving you a preview of what we're doing with access to health, some of the exciting things. The other thing I wanted to say about that is that it will be located at Mangum Howell Community Center. It's off of Frick Road, and the Baldry Grayson Community Center, which is off of Corpus Christi, like in the Cloverleaf area. We also will have a counseling room where we do virtual visits in our veterans building in Channelview. So 3 locations. It is a partnership with Harris Health, with the Harris Center, the VA, and the Harris Center for Mental Health and Intellectual and Developmental Disabilities. So the dream is, and we're always dreaming big in Precinct 2, is that they have mental health counseling on demand. Because maybe somebody can't get to the mental health pod in the Aldine area. So we're trying to make health more accessible and, stop people from maybe going to the emergency room or going to places when this could be handled a different way. And we can go to the next slide. And what I want to talk about is a community partner program. We have that in health services. And what we do with that program is we can help older adults, people of any age, but we can help older adults with an online application to sign up for food stamps or to sign up for state benefits. Oftentimes, people don't sign up for programs because it's too time consuming. They don't understand. It's a lot of red tape. And so we try to, again, remove those barriers. So we do these by appointment in our office. We are in the Channelview office. But the most excellent news is that, again, we partner with other community partners, collaborators, definitely the health department, and the health department has their Connect Navigators program. And so they do this similar program or pretty much the same, but they're not confined to Precinct 2. They can go anywhere in Harris County. So that means the city of Houston, if they can't reach someplace, then they have the connection that does that. There's so many community partners that provides this service, including the Houston Food Bank, just to name one. But I even know that Baker Ripley has the health department navigators. So there's such an opportunity for cross collaboration There's such an opportunity to say, this agency does this, but it only goes this far. Let's do the whole thing. So we know you do this, so let's connect them. And I love that we do that in Precinct 2. We need to do more of that and less working in silos, because we would be able to provide more services. Next slide, please. So some of this exciting community partnerships that I'm a part of as well is for example, I have this picture of this Project Health CVS mobile unit. So last year we had the CVS mobile unit going to different community centers when we knew that seniors would be there. They could be there playing board games, bingo. They could be there celebrating birthdays, their monthly birthdays, and we could have 50 or 60 or more. So then we have a captive audience there. Then we'll say, hey, why don't you, of course, if you're eating birthday cake, go get your screening before you get that cake. But the thing with the Project Health is they were offering, the blood pressure, the basic things that you would think about. They did have the cholesterol, but this year we will have them again in all of February in different dates. You can find the information. I'll share it on the screen how to find this for us. But what I noticed this year is it's basically a free, no cost, no catch. In other words, it's not a lot of red tape. And you can get not only the blood pressure, glucose, cholesterol, BMI, but in addition, depression screening. I'm like, wow, depression screening, mild cognitive impairment screening, and osteoporosis screenings for 55 and above. And I just think that's so wonderful, because we know, at least, especially in my own family, that you start getting nervous when you start forgetting something, or did I leave the keys? Can I retrace it? Is this normal? Is it not? Or Alzheimer's runs in my family, so then I can get very nervous about it. And so this takes, in my opinion, the fear. If we can get a screening that's free, that's available, again, it's about building those partnerships and about building trust in the community. Sometimes people don't, I've heard them say they don't like their primary care physician if they have one. They don't like them. And I'm like, we need to change it. We need to have a good relationship with them. But if you have a good relationship with Connie, then great. Then get this screening because I see you're concerned. And so it's more than, in many ways, and this is what I really love, when people are passionate, as we are in our precinct, about serving the community, they trust us. And I don't take that lightly. I make sure that, we try to get them the services that they need. They do the professional consultations. I've had it done myself. They do a really thorough job with these CVS, Aetna, Project Health. We also have flu shots. We bring Walgreens to the community centers. Now, they have limited number of free vaccines, pneumonia, flu shots, but it's a convenient to our seniors that are already at the centers for whatever reason. They're there exercising. And so they're able to get a flu shot, or they do take the insurance, obviously. It's just like having a Walgreens, but right there in your community center. But then we also partner with the health department for Harris County to give those that are uninsured, that we know that are in our precinct, the flu and pneumonia shots and other vaccines. And we have different programs to address uninsured because those are high need. And then I wanted to mention this picture here. We do a partnership with another agency called Salud en Mis Manos, Health in My Hands, and it's with UT Health. And it's specific to Latino women, making sure that they receive at low or no cost if it's available in their zip code where they live. And this is not specific to Precinct 2. This could be anywhere in the county. They stay on the line in their language and find that resource for them for pap smears and mammograms, HPV vaccine. And I took this picture and included it because these two women, one of the community health workers from UT Health, Salud en Mis Manos, she came up to me afterwards and she said, these older women that did not speak English, she said, they've never had a mammogram before and they're, past this age. And so to be able to provide a service to someone that is looking for it in such need, it's really a blessing. So I wanted to include that in there. And I just took a couple of pictures of the Walgreens. We do partner for women of all ages. that are needing a mammogram. I just wanted to mention our precinct with TSU and the Rose. And so that don't have insurance, because again, we're trying to meet those needs, but I just wanted to mention that. So the next slide. So these, like I said, I even dream big. I dream big with Precinct 2, and I'm very humbled to work there and be there with them. They're always trying to expand their programs. We know that the homebound people, seniors that are getting their meals, they have pets. And we know how good pets are for your mental health and a companion and your social. Besides the driver, that might be the only the animal they see. Lowers their blood pressure, but sometimes they're on a fixed income, and it's a challenge to get them to. Lyondell partnered with us before to provide some of the pet food once a month, and we're always looking for community partners to do that. We do take donations, and so some people say we can't donate money. Well, we take donations of other things. So reach out to us. I'll show you on the later slides how to find us. But we're always trying to expand our programs. I think in Channelview area, that's where our office is located. Lyondell had also come in behind the community center and built some garden wooden boxes where the seniors are able to do their gardening, and then they're able to. So then there's an opportunity there, and we're always trying to improve and make sure we have cross-generational opportunities. We know that young people have things to contribute, and then the older adults have things they can contribute, back and forth. So we do have some programs, but we're always looking to expand that. That could be tutoring. I think during the time I've been in Precinct 2, even a little before, the one event I was at, I said, let's do a selfie. And at that time, they didn't know what a selfie was, or they knew what it was. And when I did it, then they came up to me afterwards and they said, Connie, can you help it? Show me how to take a selfie. And I said, sure. Well, yeah, we'll do it. But now we're going to have these digital literacy classes. And what broke my heart is they said, yeah, we asked our children and they didn't want to show us. And I thought, well, how quick that would have been to show them. But, we sometimes dismiss people. And I always think, we shouldn't do that. We should be kinder, gentler. We always want to expand home repairs. You can imagine we have a waiting list for that. We want to add additional vaccine clinics. I think the biggest challenge, and it's still a challenge now all over our country, for uninsured people and the shingles shot. Believe me, I have done a lot of research on that. Because I want to meet the needs of those individuals. The law had changed for 2023. So I'm not going to say it's covered, because every single person is different. Some people have railroad retirement, and then they have traditional Medicare, and then they have a Medicare Advantage plan. So then when you start talking about all these different, they don't have Part D, and it was supposed to be covered under. So in 2022, it was covered under Part B, but not all of it is there. You had to have Part D, and some people didn't have Part D, like with the drug. So then you cannot make just across the road and say it's all covered. In 2023, the law has changed, which is a good thing, and more people are covered for the shingles shot if they have Medicare or the traditional Medicare or Medicare Advantage plans, but it's on a case by case. It just depends. Is there a copay? Is there a deductible? It would be different to every person. However, the uninsured, that's still a loophole. There's some agencies that we're currently trying to work with and see if we could, meet that need and find that. But that's one of the challenges. It's really cost. It's a 2-dose regimen. You start talking about $180 per dose, minimum 2 doses. Most people will say, well, I can't afford that. And that's totally understandable. So those are some of the challenges that we have. We can also coordinate. If you have a big volunteer, you have a corporation or an agency that says, we have all these people, we have the manpower, and we just have this one-time project we want to do. We don't have any money, but we can coordinate a project. So I wanted to mention that, because when I was doing research, I thought this is important to note. Some people say, well, do I have to have everything in order? No, you don't. We can help you and to help the community. That could be the focus interventions could be someone just needs someone to clean their yard. And we've done that too. We've cleaned people's yard because the neighbors are complaining. And I think there was a case, we had a husband and a wife that were both older, disabled, and they had a blind daughter that lived with them. So to be able to help clean the yard or do something as simple as you think that would be, I mean, it was such a great blessing to them, but we were able to coordinate that. And so let's go to the next slide. I think we're just about there. So 501c3 is the Precinct Together. We have our own Facebook page and people follow us there and find out all the exciting things happening with Precinct Together. And that's how we're able to do that. All the services that we provide in addition, and it's been since 1975. So it's been there for a while. Let's go to the next slide. This is how to contact us. It's a 713-274-2222. Please follow us on, you can go to our website. We have all the information that I talked about there. We have, Facebook, Twitter, TikTok, Instagram, YouTube, Nextdoor, LinkedIn. We're socially connected. But, we do old school things too. We make a lot of flyers. We go out and to the community centers. And we try to make sure that the people that maybe are not engaged digitally, they're engaged still. And then we have, let's see, one more is this is the bonus you get. If you stay till the end, you get this information. If you didn't know, Harris County, not Precinct 2, but Harris County, it's in Universal Services. It's basically I'm old school, is a county operator in my thought. But from your cell phone, if you call 311, you will find whatever you need. There's a pothole in this, or I need to know where to find, or I don't know what precinct I'm in. I don't know if I'm in the city of Houston. You can find just by calling 311, and they will be able to direct you. And you can also go online. They also have social media. Harris County 311, and you can find any information, and that's new. I think it was last year that they implemented that. And then let's go to the next slide. This is our health services team. This was for breast cancer. We try to take pictures and try to raise awareness. And then lastly, there's my contact information, and I'm happy to answer questions or serve the community and Precinct 2, but if you need resources beyond or in Harris County, I am, happy to serve as a community health worker instructor. And again, I thank Hope and Healing Center for having me today. As you can see, I'm a talker, so I will end this with this. I was raised by my grandmother, and she's the one that had Alzheimer's, and I dedicate all my work to her. But the funniest thing that I always think about her is she's gone now, but she said, "Girl, I don't know what we're going to do with you in that mouth." And I just, it kind of brings a tear to my eye. But at the same time, I say, I'm doing good things with my mouth. And so with that, I thank you.
And we thank you as well for an amazing amount of information that you put into a compressed amount of time. And thank you so much for that. That is terrific. Everything that's going on, everything that is upcoming. I'm going to go ahead and I'm going to stop sharing the screen here. And I do know that there are a number of folks who,
they're just saying thank you.
I was going to say there's a lot of thank yous.
Hopefully there are questions, but I can answer them if there are, because we're out of time.
The most commonly asked question, for which I will answer right now, is if you've registered, and if you've registered, then you're either here with us today in person or you are watching this live or recorded. You will receive links to, of course, the recording, and you will receive copies of the slide deck that was used today. So if there's something that you didn't quite catch, we're going to send it out to you. So the most commonly asked question, and ultimately I see a lot of hearts and thank yous, outstanding jobs, and I see that there's a whole bunch of folks who are essentially just adding in their contact information, which is terrific. These are, and ultimately, I don't see any questions.
Oh, great.
Yeah.
But if they have any, they can always email me.
I appreciate certainly.
Find me on social media. My name is Connie Assiff. It's most unusual.
And what I will say is that for those of you on Zoom, for those in partner services such as the Archdiocese of Galveston, Houston, I see here the Harris County Area Agency on Aging, just some examples of collaboration in action. Folks tuning in for Connie is surely a sign of respect for your dedication to our community for these years, but also an opportunity to demonstrate that there are no competitors when it comes to meeting the needs of the marginalized in our community.
But can we also just take a moment here?
I apologize for 1 second because as I have one.
Somebody's talking.
Go right ahead. Try that
yes,
again.
I want to take a moment here to just celebrate Charles celebrating his wife. Listen, that is freaking amazing. Connie can't see the comments, but he said he is proud of his wife. For us single people out here, that gives us hope, honey. So if I don't have a husband like Charles, throw him away.
And thank you so much. That was, and affirmations are always welcome. That was terrific. Thank you for that. And your question, please.
I do have a question. This did not happen locally. It happened in Euless, Texas. My sister, who was 12 years my senior, got dementia. And her husband cared for her as long as he could. And he was not very socially aware. So when she started escaping the house and wandering around, the family called me to come in and figure out what do we do with mom. The kids were not good problem solvers, but I am. So I really struggled to find local resources to plug them into. I ended up, by the grace of God, finding a agency that case manages elder people, and they helped me with that. But it is one of the questions I really did want to get answered today. And this may not be the right part.
No, I can tell you because I experienced the same thing.
Yes.
Because I started caregiving at 25. And so this thing about maybe a younger person knows better than an older person, the resources, I was deer in the headlight. I have no idea. So what I tell people in brief is something that Seth had mentioned, which is the Area Agency on Aging, which is the AAA, and the Aging Disability Resource Center, ADRC, can be found all over our United States. And it was put in place by the Older Americans Act. And so you can Google Area Agency on Aging, Euless, Texas, Area Agency on Aging, Tallahassee, Florida, New York, and it will take you to all those different it's a good starting point. In other words, that's where I would begin on the whole maze. And so that is what I never could, I wanted like a little answer, and that is the answer, really. And the same, you can Google the ADRC? It's Aging Disability Resource Center. And I tell people with the ADRC, you get a bonus because it's a disability at any age. So that means there could be other resources there that, yeah.
Oh, cool.
Yeah. Thank you. And just for those of you who are on with us, the question of first-timers in situations where you just don't know where to begin when it comes to helping to manage the care of someone who is senior, who is disabled. And again, Connie's answer, of course, came through loud and clear. Terrific resource information And we will absolutely echo that. If at any point in time, any of you who are regular listeners here at the Hope and Healing Center need that information, feel free, please, to go ahead and to contact us. And we will direct you to the Harris County and surrounding counties, area agencies on aging, aging and disability resource centers, long-term care ombudsman programs. And in turn, you're going to get connected to a variety of other agencies, private and public, that will go ahead and God willing, meet your immediate and your long-term care needs.
Now, why I say to start there is because I don't want to say anything negative to any for-profit companies, but I wouldn't start with a for-profit company because in my mind, they're for-profit.
Right.
I'm going to start with the local, state, federal government agencies, nonprofits, Alzheimer's Association, whatever that is. And even in that case, people will say, well, my loved one has dementia. They don't have Alzheimer's. Well, but Alzheimer's is still a good starting point because they have all these other resources. If I had an issue, we have adult protective services here. If I had, and we do deal a lot with them as well, we have referrals, then we want to be sure to say, well, adult protective services may not provide that service, but I know they get this question all the time and they will know. What I call it is connecting the dots for caregivers. And that's what, when we were younger and we connected the dots and said, oh, it's a bird, that's exactly what I wanted. And I want that in Harris County. And I'm happy we're a part of doing that. But Seth is correct. We're stronger together and it's not about competing. It's about us encircling the community and getting things done.
And to be absolutely fair to our to those in the for-profit industries that generously underwrite the efforts
You're
of
correct.
Public sector, NGOs, other nonprofits, we value them
Definitely.
immensely. However, they have put their trust in government agencies, in nonprofits, and other NGOs in order to go ahead and to make sure that you are starting on a level playing field and understanding what all of your options may be, which may include for-profit services, if in fact that is the best outcome possible for your particular situation. So your mileage may vary.
Right.
Is another qualifier to that, which is we here at the Hope and Healing Center and Institute won't necessarily start with a for-profit referral unless we are already aware that it's a specific niche that's being filled and by that for-profit individual or agency or company that isn't being filled in a nonprofit or similar arena, and that we have vetted them to go ahead and to take note that they are conducting themselves honorably. But I will let you know, as my experience as a chaplain prior to being here includes both not-for-profit, nonprofit, and for-profit. There's a reason why I'm in